Good morning, everyone. Thank you for sacrificing your time on the weekend to join us for this webinar. I understand we have over 700 people online. So on behalf of the panelists, I would like to extend a warm welcome to our friends, colleagues, and students joining us today. So this webinar is organized by the Alice Lee Center for Nursing Studies at the National University of Singapore, in collaboration with the University of Washington in the US and Hangzhou City University in China. I'm Prof. Wenru from NUS Nursing, and I will be moderating today's session. So we are very privileged to have three speakers with us today. They will be sharing their insights on how AI is shaping chronic disease prevention and care. So feel free to raise your questions throughout the session. Our panel will answer your questions during the Q&A segment at the end of the session. Okay, very warm welcome to everybody. Let me share my screen. Okay, so today's session, we will discuss on the topic of from virtual assessment to virtual exercise, how AI is tailoring chronic disease prevention care. First of all, let me have a brief introduction of three speakers for today's session. So our first speaker is Dr. Weichao. Weichao is currently an associate professor at the University of Washington, USA. Her research focuses on the intersection of culture and health, with a special emphasis on the leveraging technology to improve health outcomes for marginalized communities. She's leading projects funded by the U.S. National Institute of Health, including initiatives to enhance access to care for marginalized caregivers using natural language processing techniques. So Dr. Weichao is also establishing a machine learning for health equity lab at her institution. And our second speaker is Dr. Zeng Yingchun. I believe some of the audience already know her very well. So Dr. Yingchun is an associate professor at Hangzhou City University in China. She has led numerous research projects, including those supported by the National Nature Science Foundation of China, with over 19 publications in international peer-reviewed journals and recognition as a fellow of the American Academy of Nursing. Dr. Yingchun's expertise spans healthcare research and innovation. And finally, we also have our Dr. Jiang Ying. Jiang Ying is an assistant prof at the Alice Lee Center for Nursing Studies in US. Dr. Jiang Ying's research interests include chronic disease self-management, health promotion, and active aging. Her current project, supported by the National University Health System Seed Fund, aims to enhance active aging and reduce falls and depressive symptoms among older adults using a combination of dance and innovative technology. Very interesting topic. Later, Jiang Ying will also share with us about her research project. So yeah, before I hand over to the three speakers, I will just have a very quick, brief introduction of existing digital health initiatives in Singapore. So as we all know that aging population is a global issue. Like the US and China, Singapore is also facing similar challenges of aging population. So in Singapore, currently about 20% of the population is aged 65 years or above. By 2030, it's projected that 1 in 4 residents will be 65 years or older. So as the population ages, we can see that there is a dramatic increase in elderly individuals living alone and suffering some sort of disabilities. And currently, we know that non-communicable diseases or chronic diseases actually take up more than 80% of the total disease burden in Singapore. So the top 3 chronic diseases are cardiovascular disease, cancers, and musculoskeletal disorders. But if you look at this table, mental health disorders are also a significant concern in Singapore, because you can see over 10% of the population in Singapore also experience mental disorders. The prevalence of chronic diseases increases with age. Looking at the stats in the table, here I show you, you can see in 2009, about 20% of the elderly in Singapore had 3 or more chronic health conditions. This number had doubled to nearly 40% in 2017. So I believe this number is even much higher now. And so to encourage successful aging in Singapore, the Singapore government has implemented various strategies to boost healthcare industry manpower, enhance productivity, and increase innovation through collaborating with the industries to develop innovative solutions for the future. So one of the most important strategies highlighted by the government is to use technology to empower patients in care. So with the use of digital health interventions, we can empower patients in our care through their own self-care, self-manage, and facilitate communications with the healthcare team. And in the next few slides, I will share with you a few nationwide digital health initiatives implemented in Singapore. So in this slide, you can see in Singapore, actually almost every body has a mobile app installed on their mobile phones. This app called Health Hub. So with this app, Singapore residents are able to access their health records online without having to visit hospitals or clinics. They can actually make medical appointments and track their medication prescriptions, even view their lab results. So during the COVID-19, we know everybody have to do the vaccination. So they can actually use this app to monitor, they track their vaccination status and even can download their vaccination certificate. So all the data actually are conveniently available on their mobile phones. And teleconsultation, I think you probably already very familiar with this. So teleconsultations have also become increasingly popular in Singapore, especially during the COVID-19 pandemic. We know that teleconsultation enabled the healthcare team to remotely monitor and consult with our patients to ensure the continuous care. And as we know that with an aging population, more and more people will suffer chronic disease and physical disabilities. So rehabilitation becomes crucial for these individuals. Tele-rehabilitation technology is also consistently improving to enable patients to undergo rehabilitation at the comfort of their own home. So this is especially important among the elderly, as improved function status can actually reduce the risk of fall and also the chronic diseases. So in Singapore, there is a popular app. You can see this app called 365, meaning, you are expected to use this app every day. So this app launched by the Health Promotion Board a couple of years ago. So this 365 app is a nationwide health promoting app that integrates wearable technology to encourage people to adopt healthier lifestyle by promoting their walking and exercise classes. So our residents can actually accumulate the steps and, even accumulate the steps and redeem supermarket vouchers through the app. So this initiative is not only promotes healthy behavior like physical activity and healthy eating, but also fosters social bonding through group exercise classes. And also in recent years, AI and artificial intelligence has been also increasingly used throughout the healthcare continuum in Singapore. from administration to clinical decision support to increase system efficiency and to improve patient outcome. But along with the benefits of using AI, there are also risks and ethical concerns if AI is not safely designed and implemented. So to support patient safety and improve trust in the use of AI in the healthcare system, the Ministry of Health in Singapore, the Health Sciences Authority, and the Integrated Health Information Systems co-developed the Ministry of Health AI in Healthcare guidelines. I believe maybe in China and also in the US, you have some similar guidelines. So these guidelines actually share good practices with AI developers and AI implementers. So like the healthcare institutions, hospitals, clinics, and also the laboratories. These guidelines also complement, health sciences authorities' regulations of AI medical devices. So I think it's very important for us as a healthcare professionals to understand these guidelines before we really implement the AI in our patient care. So I won't be able to go in very detail about this guideline. If you are interested in find out more about this guideline, there is a QR code there. You can actually scan the QR code to find out more about these guidelines. Okay, so in line with the rapid, increasing utilization of AI and digital technology in healthcare, so we are very, very honored today to have three speakers to share with us about their insights and projects on how AI is influencing chronic disease prevention, care, and the promotion of active aging. So now I would like to invite our first speaker, Dr. Weichao from the USA University of Washington, to share with us about her topic on the large language model, enhanced support for family caregivers. Okay, Weichao, I hand over to you.
Thank you, Dr. Wang, and thank you for the invitation and warm welcome. I am very privileged today to attend this webinar and share our team's work in using large language models to enhance the support for family caregivers. I will start with some introduction and definitions, and then go into our team's work in using generative AI, LLMs, in supporting family caregivers, which is our population of interest. And then I will also share some future directions that would be interesting and encourage you all to explore with us. So some background around family caregivers. In the United States, there are 60 million family caregivers, and 3/4 of them are the US working workforce. So a lot of them are what we call the sandwich generation. So they are not only raising young children, but also caring for their elderly family, just like Singapore. So those people are the backbones of our healthcare system. And the majority of them actually report wanting more resources on caregiver-related topics, such as how to care for themselves. And that's actually the #1 need for family caregivers in the States. In response to these huge needs, while we know that family caregivers don't have time or money or other resources for themselves, whenever or whatever they have, they want to give it to their loved ones. So if we only have 5 minutes that our family caregivers have for themselves, that's what we have every day to care for themselves. So we wanted to develop something that's on demand, that's available to them, and very likely in the middle of the night when their loved ones are asleep, but they are awake, worried, having sleep disturbances and couldn't fall asleep because they spent the whole day stressed out caring for their loved ones. So with that in mind, we developed COCO. COCO stands for Care for Caregivers Online. So COCO is a mobile application that's tailored for and provides empathetic care for our family caregivers. COCO delivers evidence-based interventions, such as daily check-ins and self-care tips, health tracking, tailored caregiving resources, and evidence-based therapies through the chat. So here on the right side is a screenshot of our chat interface, and here it's delivering problem-solving therapy and evidence-based therapy that has been validated to that actually works for family caregivers. As you can see here, that Coco's chat interface, and this is actually an actual conversation that happened with family caregivers, and Coco's chat interface is different from what we generally see maybe in the chat bot of a customer service bot that would have a lot of buttons for us to click on. So, and that is a key differentiator and a key technology that we're trying to develop is to make the bot empathetic and be able to actually convey that they understand what the caregiver says, and then also respond therapeutically to help them improve their health. So the technology behind Coco is AI. So let me go into AI and just kind of give a little bit of background and discussion with you all. So when we think about artificial intelligence, intelligence is the key word here. Artificial means it's man-made, right? So I also have my phone opened up to see the interactions here. So I am inviting all the audiences in the chat function where you're viewing this to put in your thoughts on what is intelligence. I'm going to put that question in the chat as well. You can respond in Chinese or English, whichever you prefer. Your thoughts on the definition of what is intelligence. Okay, someone said neural network. That is a very advanced definition, and we will surely go into that one. Any other thoughts? Okay, so someone had a pretty complete definition of reflection of inferences based on the data collected to date. That is a great definition of intelligence. So in order to have intelligence, we need to have data, and then somehow we process it. And then based on the processing, then we have some knowledge about something. And then it's also evolving over time. So those are the key definitions of intelligence. So when we think about intelligence, we know humans have intelligence, and we're trying to teach our computers to have intelligence. I'm just going to pose a question here as well, that what about consciousness? So it's actually still a very live debate in the neuroscience field that neuroscientists are still debating whether actually humans have consciousness. Do we have higher consciousness? So, and the scientific field doesn't have a conclusion yet, let alone that in the future, could our computers, could AI have consciousness? Certainly they're in the movies, but at this point, I don't think in the foreseeable future that AI would have consciousness. Nor could we approve it, because we can't even prove that humans have consciousness. So here is the definition or official definition of artificial intelligence. And a lot of the users responded in a very similar kind of way, that it's a computational tool that emulates the human mind. It takes data, turns it into knowledge, and adapts over time. And it's being used and integrated in many devices. And when we talk about artificial intelligence, there are other terms that are related. And sometimes maybe we're like, okay, what are the differences, right? Certainly I see that someone said neural network. So that's a term that's related to artificial intelligence. So here is a graph that delineates the relationships. I thought it's a very nice visual to show what like the different subsets or divisions of artificial intelligence. You can see here if we have data right? Numbers, data, those when we process those, these are machine learning. And if we have text data, language, so then those belongs to natural language processing, right? And then and under NLP, there are kind of different aspects of that. And when we talk about speech, that's speech AI. And then we go to robotics, vision, and imaging and all of that. So those are all different ways or different subsets of technologies that's under AI. And for our team's work, because we're delivering interventions in chat, so we're primarily focusing on natural language processing, so NLP. And sometimes you hear NLU as well, natural language understanding. So first, the computer needs to understand, and then it'll process, and then generate new ideas. So those are the terms. So we'll go into the understanding of natural language processing. So it means takes language, it can be text or recordings, and translate it into a standard computer instructions. And it's not that easy. It's not like computer were born to learn from A, B, C, D, and all of that. So the way that we teach computers to understand, there are different ways that we can teach computers to understand. And there are challenges, such as there are abbreviations, jargons, misspelling, different words meaning different things in different contexts. These are all very complex for computers to understand. So here I am presenting an example from our lab. So we were collecting a few thousand entries of family caregivers' daily challenges in caring for their loved ones. So this mom was sharing that I was short with my daughters because they were not ready to go to school when I asked them to, right? So when we read this, we just naturally knows all the kind of understand what this sentence means. But when we teach computer to do it, we need to teach the computer what are the subjects that's involved, what are the events here, because we're trying to do therapy, right? We need to also understand or inference what are the feelings behind this. And then based on that to generate health goals. And then based on all of that understanding, then we would generate a response to help the family caregiver. So in this context, the subjects would be the caregivers and daughters. The events is that the parent was short with their daughters who were not ready for school. And the feelings is where it's kind of inferenced here, right? It's not explicitly stated, but we, as common human understanding, this parent is likely to be overwhelmed. And they might also felt a little guilty because they were short with their kids, right? So then a health goal that we could recommend is to take some time for themselves to process the overwhelming and guilty feeling. So then the computer would generate a response. So we usually first ground or respond empathetically, right? That sounds tough. Caregiving can be challenging sometimes, especially when you already have a lot on your plate. Sometimes taking a moment to center yourself may help. Which one of the following would you like to try? And then we suggest a couple of different health promotion practices and then start from there. And that's part of problem-solving therapy, that we identify a problem and then we set up health goals. So that's a very simple suggestion. And that has been what our team has been working on for about 3 or 4 years before this come in. So last year, it was all over the news that there is this company out of nowhere that they launched this thing called GPT, ChatGPT. It's from OpenAI, and it's crazy, right? It can do things that are scary, scarily well. So that started last year, and I found a kind of an image from online in Chinese, actually, to kind of explain what are the changes like, and why was there a breakthrough last year. So our team was working here, right? And I mean, we knew GPT, OpenAI, and Transformer was from Google. So a lot of big companies are working on language models and how to process, and they might have different kind of foundations of how they processing or how they teach computers to process information. Until about a couple of years ago, GPT had a breakthrough where the language models had an significant increase in their ability to generate text that makes sense. And then since then, and it was GPT-3 and then 3.5, and now there's GPT-4, that they had another breakthrough in actually significantly reducing hallucination and having higher confidence in the right answer that GPT could provide. And then if we look back into this image about AI, where would generative AI fit in? So generative AI is a subset of AI that's generative. Generative means creating new content. So when we ask computer to create new content, we call it generative AI. And it's every time, even if we ask the same question to a language model, large language model, to ask them to generate something, usually every time when we ask them the same question, the answers are different because it's all about probability that what they will produce. And the improvement from GPT-4 from GPT 3.5 was that actually the accuracy of the best answer increased from that. So then we asked the question that our team has been working on to the large language models. And I think this one in particular that I shared is using Google Gemini, so another kind of language model machine. So we asked the chat bot that I am taking care of my son with autism. I'm tired and worried about his future. What would you say to me? And here is the generative AI's response. I'll give you a moment to review this. So it's pretty good, right? So it says, I understand, right? And it grounds, it provides this sort of empathetic response. And then it started with the validation, which is a common kind of therapy response. And then it also provides support down. I didn't have the whole screenshot, but down there, it also found some online resources that the parent can take a look at. So this is an okay response. Like, it's not perfect because when we do therapy, it's never like we tell the therapist, I'm worried, and then the therapist responds with like an essay telling you what to do, and we end the session. It's always this interactive conversation, right? So there are things that we need to do to fine tune it. So there are techniques such as fine tuning or prompt engineering to tell the bot, here's what you need to say, or like, an example of a prompt would be help this parent with their symptom in 5 turns of conversation, right? So then the bot will try to respond bits by bits and work on that. So that's a very simple prompt engineering technique. And they're not that simple. And to be honest, we've been trying different techniques and things. And our lab is recently submitted a paper around kind of comparing different prompt engineering techniques and see which one might work in health. And we haven't found like the one that works. It'll probably be a combination of various technical techniques. The other aspect that our team is working on is, I am an immigrant. My primary language is Chinese, and I would always be wanting to kind of receive any therapy or health recommendation in my mother tongue. And so does a third of Americans who prefers to speak a different language at home. So our team wanted to kind of look at do those generative AI models have the ability to deliver therapies culturally sensitively, right? So like a Singaporean who also speaks English might want to do things differently when they're worried, right? So we asked the bot then, okay, so this one we asked bot, I am a Mexican American, right? There's a lot of Latinos in the States, and I'm taking care of my son with autism. What would you say to me? And note that we had to add in English because if not, they would start, the bot actually assumes that I speak Spanish and then would start responding in Spanish. But anyway, so here is the response. So you can take a look at here, the response to a Mexican American parent compared to when we did not. The response is actually very similar, right? The bot tries to say, oh, as a Mexican American, right? What this could be, but then the content is actually very similar. And you can note also here that in my prompt, I said, I am an Mexican American. I did not say that my son is Mexican American, but when the bot responded, it actually assumed that I had a Mexican American son as well, right? So these are the things that what we call hallucination or just making things up by the bot. And they seem very confident of their responses. And because of these things, I mean, there's a lot of work in this area in kind of examining the ability of bots. And there is this paper that says the GPT-3 actually have an American accent. It's not culturally or linguistically sensitive as well. So if we go back to the example that I shared about that mom that was short with their daughters because they were not ready to go when the parent had asked. So here is the response from, I think it's still from Google Gemini. All right, again, it's an okay response, right? It kind of touches the surface of things, right? It's kind of like when we Google something like, I'm stressed, what should I do? Like this would be something that you get. But we all know that knowledge or cognition doesn't equal to behavior change, right? We all know that we need to eat healthy, we need to go to bed early, but none of us are able to do it because behavior science is another level, right? So what we see that one of the challenges of those generative AIs in delivering health interventions is that they can probably give a good, like, okay answer, but they can't interact with you in multi-turns and then help you in a way that can actually change your behavior. So that's one challenge. The other one that I also mentioned is around cultural and linguistic adaptations of health interventions, right? So I know the majority of the audiences are in Asia, and we know, sometimes there's a lot of health interventions that are validated from Western countries, and then we want to take them and efficacious ones, right? The ones that worked in Western countries and take them in Asia and adapt them and see whether it works in Asia. And we were curious, okay, when it's done, is it always manual adaptation, right? So here is a review paper that was published about 3 years ago that they just looked at cultural adaptations of internet and mobile-based interventions for mental health disorders. And they categorized all the kind of, when we do cultural adaptations, what are the ways, or what are the components of an intervention that we need to cultural and linguistically adapt, and they put these into these taxonomies of like characteristics, illustrated activities, values, right, language translations, structures, guidance, and all of that. And what our team did recently is we did another scoping review, actually looking at how they are done. How are those adaptations done? And what we found is that I think we included about 50 studies, and only one mentioned natural language processing or NLP. The rest are all manual adaptations. So there is huge potential in using machine to help us with the cultural adaptations, right? And I mean, we're lucky, or the majority of us are lucky, like Chinese is the most spoken language worldwide, right? So there are lots of resources that we can do to adapt or translate interventions into Chinese, but there are a lot of languages that maybe are spoken by a few and they don't have the resources to adapt those interventions into them. So can we use machine? So our team recently actually did a review using this taxonomy and then kind of discussed the different aspects and what are the methods of informatics tools that we can use to help with the cultural adaptation process. It's under review in the journal Biomedical Informatics, and we've gone through one round of review and resubmit. So hopefully you'll see that soon. And that's where our team is working on. And there's so much in this field that I really welcome you all to join us and harnessing the power of AI in helping us improve the health of our human beings. Thank you very much. And that concludes my talk. And I will stop the share. Dr. Wang, I think you are muted.
Okay. Can you all hear me?
Yes.
Yes. Okay. Thanks, Weichao. Yeah, it was very informative and insightful presentation. Maybe I just have a very quick summary for the audience to have some take-home messages about Weichao's presentation. So I'm very sure that for the audience, you may already familiar with the term, AI, artificial intelligence. However, there can be various interpretations of the AI. I think just now you shared your answers in the chat. We can see, you all have your, your own interpretations of AI. So it's good that Dr. Weichao actually shared with us about the definitions of AI, including generative AI. So she also shared with us about the natural language processing as a key aspect of AI, along with the recent advancements in the large language models. I'm not sure actually how many of you guys have used ChatGPT. If you haven't, please do try ChatGPT. So Weichao also shared her research on using these technologies to support family caregiving and discuss some of the potential future research directions. Thank you, Weichao. So I think later during our Q&A session, if you have any questions, you can still ask your questions, okay? Okay, now I would like to invite our second speaker, Dr. Yingchun from Hangzhou City University, to share with us about her topic on immersive extended reality and metaverse application to nursing research and education. Yeah, Yingchun is yours.
Thanks, Professor Wang's kind introduction. It's great pleasure to introduce my study. The title is a bit different from my poster because each time I would like to introduce some new information. So in this presentation, I will introduce some new information related to metaverse. So yesterday, I read an article from the Lancet Digital Healthy. From this graph, we can see AR in healthcare is sharply increased in the recent 5 years. The leading country is the USA and China. So USA is have 27 trials, RCT means, and China is have 26. I also see Singapore have a trial as well. So, and the majority of this kind of trial is in care management and the clinical decision making. So, in my presentation, I will introduce 3 parts. So, what's XR technology and what's metaverse, and how to apply XR or VR technology in nursing research and introduce some examples of metaverse applied into nursing education. So what benefits to XR and metaverse in healthcare? So my first part is to overview of this type of technology. So XR is a general term to describe AR, VR, MR as a whole. So AR can be added to some new information like top of reality through a phone screen or small glasses like iPad something. So AR aim to project some virtual content and into real environment. So it's combined with real and virtual imagery. For VR, is completely fake. So VR technology is sought to create convincing illusion that you are somewhere else. And mixed reality is a term. Is type of is an enhanced AR, is a blend of physical and digital world. Like physical, this is MR, is a blend of physical world and the digital world. So XR technology allows people to learn about different people, places on Earth, and beyond such a metaverse. So what's metaverse? Metaverse is the evolving concept. Actually, this is a large concept in visions of virtual realm where people can connect, interact, explore in the digital universe. And the users in the metaverse can create a personalized avatar, socialized with others, engaging various activities. So when you listen to this, people, some metaverse is a type of entertainment. Actually, we can apply some metaverse in nursing. For example, one of my review articles is published in Journal of Nursing, but this picture didn't publish, only published my text. 其实我很喜欢我这个图，这个图我是想了很久的。这是我想的这个 metaverse 怎么用到这个 elderly care， 用到这个智慧康养。Actually, this metaverse key technology for metaverse is including blockchain, cloud platform, internet, 5G communication technology, Internet of Things, and XR technology. This all technology is a key technology for metaverse. So for elderly care, when using some AR or digital technology, they can accept all type of care, like at home, daycare center, community medical center, even in hospital as well. So this is one type of metaverse, how to apply metaverse in elderly care. Another example is apply metaverse in cancer care. So I write this editorial to show, to describe the potential application scenarios for metaverse in cancer care. When we apply this metaverse advanced technology, also we will face some ethical and legal challenges, and also make summary for how to apply this technology in nursing as well. If you are interested to apply metaverse in cancer care, elderly care, you can read my articles. So in this presentation, I will focus on to present my two projects. So how to apply VR technology in cancer-related cognitive assessment and cognitive rehabilitation. So this first project is use VR cognitive assessment and rehabilitation for cancer patients. This project is funded is a National Science Foundation. This is one type of top grant in China. It's highly competitive every year. Actually, I completed this project in last year. So I published the serial articles because we have only 20 minutes to present our work. So I will not present every detail in my study. If the audience interested into how to use immersive VR for cancer-related cognitive impairment, and for you can read my publications. So this is the key framework for VR cognitive assessment system. We include in 3 key domains. Why we choose these 3 key domains? Because we have an international and cancer and cognition task force. So this task force recommend this 3 key domain is for assessing the cancer-related cognitive impairment. So we developed this VR version. For each cancer patient have lots of psychology problem and sleep problem. So we feel anxious, have depressive symptoms, and also have sleep problems. So we are not just assess people's cognitive problem, we also assess cancer patients' psychological and sleep problem. If the patient have a high risk of cognitive impairment, so we recommend the patient to take the single domain or multi-domain of VR cognitive rehabilitation. Also VR psychological intervention as well. So our system, this is the rehabilitation part. And then we do the after 2 weeks intervention, we will do the evaluations. If effective, will be fine. If ineffective, we are referred to clinical rehabilitation expert. And this system got the invention patent. This is very difficult for us to retain this as well. So this picture shows the whole system. This is the VR system. This is the first patient, cancer patient we recruited for assessment. So this is the 3 key domains to assess the cancer-related cognitive impairment. This is the lung cancer patient. Is very young. I remember it's some 40 or something. Get the lung cancer. Or take the VR cognitive rehabilitation. This single domain or multi-domain task. This is some picture to show our system. And these tables is show our finding in our articles. And this is the highly correlation between VR cognitive assessment and the standard neural cortical test. So from this finding, we can conclude that because uses have high sense of presence and without provoking sickness. So we consider this VR cognitive assessment tool is acceptable and acknowledged valid instrument. And this VR tool is strongly correlated to those traditional neural cognitive tests. So indicating this VR cognitive tool have good concurrent validity. My second project is use VR cognitive assessment for elderly people, especially for mild dementia. And this project got gold medal. So this project, I invited to publish a top Chinese nursing journal and also present our finding in international conference as well. So why we need to concern related issues of mild dementia? Because mild dementia is a critical point for controlling cognitive decline and the important target for secondary prevention. Because only detection can minimize the onset of neural degeneration. So it's important to develop cognitive assessment for only diagnosis. And some reasons why we use VR cognitive assessment for mild dementia, because there is a lot of advantage for VR cognitive assessment. The first one is control stimulus delivery, and the real life scenario, like playing games and completed the VR cognitive assessment. And also is very low cost function environment compared with some real equipment. So the 4 key domains for assess mild dementia, we refer to lots of literatures. and consult many experts in elderly care. So we choose these 4 key domains to assess the mind dimension. So why we choose some immediate recall? Because the learning, recalling is correspond to executive function. So these are contribute to only diagnosis. For tomographic memory, recognition, recall, this spatial layout belongs to the hallmarks only diagnosis as well. For prospective memory domain, because the deficits in medical adherence is one of the earliest signs. So for comprehension, because some elderly people communication difficulty and the deficits of social skills are important domain of diagnosis of mild dementia. This is a setup, but now will be easier. This is at the daycare center of Hong Kong. This task is when the elderly people wear the VR headset to assess the immediate recall within 2 minutes. We will ask the from the audio voice request the participant to pick up 3 tools from this cabinet. And the second domain is tomographic memory. The task is request the user to remember the sequence of the 4 photos and display after 15 second display to ask the user to sequence again these 4 photos correctly. And for prospective memory is a virtual TV host broadcasting 3 TV program. Ask the user to mark in the 60 ticks in order. At the end, and the user should remember to take his wallet for shopping. So the final key domain is to assess comprehension. Because the comprehension, because many Chinese old elderly like to cooking. So we ask the user to prepare a dish like stir-fried beef with broccoli, with under the instruction of audio. So to assess the patient's comprehension. So this is the another project, and also we have some several publications. We can search my name and read the details from my publications. So the this part is a very new part. I didn't present in elsewhere. So how to apply the methods in nursing education. So this example is from a technology company at Sherman. For nursing methods teaching platform, we have 4 layers. From the bottom is core computing layer, and the second layer is data layer. The third layer is interaction layer, and the top layer is presentation layer. Presentation is to achieve a deep immersive teaching experience. This underlying technology like VR, MR, KV, 3D interaction video wall, hologram as well. So hologram is based on patient-driven core computing at the physical level. It's based on patient's physiology parameters. So the data layer is offering parameterized medical model, and the interaction layer is on achieving nursing intervention simulation. So here is some examples. Because for in our smart nursing app, we buy this kind of VR version of for using learn acupuncture, but our version didn't use this one. This part 就是在针灸的时候，就是用虚拟的环境去学习这个穴位去扎针。我们实验室买的这个 version 就是没有这个force feedback， 就是没有这个力的反馈。其实在针灸的时候有一个很重要的点，就是你扎针的时候要感觉到得气，就是你扎进去的那个时候有这个力度和这个感觉。所以如果是我们 use the pure VR version, so you have lots of limitations. we only use the MetaVerse version. We have to use the learn the force feedback technology, so it can feel the puncture field from different tissue. So this is one type of MetaVerse scenario. Use the learning the acupuncture. So another thing is use the soft body body simulations. So is that also need to use the simulation of force feedback， 就是我们在学缝合、打结、切割这些软组织的时候，我们只是就是虚拟的环境里面，如果没有这个力的反馈的时候，其实我们的学习效果是很差的。现在这个公司的技术会越来越先进，他们不仅有就是说我们学这个流程，还可以感受这个力的反馈，这样的学习效果是会更好的。所以我们现在就是这个 simulation， 就是用这个 MetaVerse会学习的效果会更好 ，so we can get a better learning outcome from this version. So another thing is the fallback version, intelligence, and many types of technologies. I don't allow my time limitation. Okay. Let me see. Oh, I can. So this is NUS Nursing TREND， 就是给变插管的时候，它有这个力的反馈，比纯虚拟的一个效果会学习的更好。这还有给男性病人的这个 tailoring also is can be learned very better with force feedback. So another type of nursing education technology. We can see this is a 3D first aid training system. This is the another system for young babies. So from this nursing education MetaVerse technology, we can get the more enhanced engagement and the retention. Also, we can got instant feedback or adaptation. So this when you press, you can feel the 压力和深度. So it's very good. Also, we can use this kind of system for standard training. So a MetaVerse technology for nursing training, we can significantly enhance the learning outcome for nursing students compared with the pure VR version. This is another example of MetaVerse collaboration system. So this is for doing the surgery. The real clinical process requires multiple rules to cooperate with us to complete the entire operations. So through the multi-person collaborative VR system, so the motion operations of training multiple characters can be perfectly solved. So this is a born or baby. This is a surgery. So this MetaVerse multiplayer is better than pure VR simulation system. This is another example of nursing MetaVerse classroom. This is the medical simulation care integrated foresight. So the
知道吧？操作成功。接着就在哪里舒服呢？我给你检查一下，你的胸口感觉怎么样？腹部呢？然后这条腿够不够？去检查患者的身体擦伤，请小心处理，小打结果处理其他的骨骼。
So this is this is another example. So we can see this metaverse classroom. We can see the full size K1 screen. So it's from the front 前面、左边、右边和地面 to capture the give the operating the feeling being on the screen。这个就完全非常的逼真，就是从你的左边、前面、右边和地面都可以高度沉浸的一个学习的一个环境，能感受这个力度，感受到这个流程，所以的话，这个训练的效果会更好。这是 another system is simulated nursing mobile 3D VR interactive world teaching system. So for metaverse nursing simulation system have lots of components. So we need medical force feedback. This is critically important. We need a force feedback interactive system, and we need to use VR simulation operating system as well. So we need a mixed virtual and reality system using the AR simulation system as well. So like Hangzhou, I see use AR for emergency training. But if this system add some force feedback, will be really better for training effect. Also use medical hologram 3D operating platform. We also use need MR simulation operating system and the K1 immersive teaching system as well. So if use metaverse nursing simulation, we need lots of technology and components. So let's take a quick summary. So what's the benefits of metaverse in healthcare? So monitor health with enable digital system. So like Lancet Digital's article, in recent 5 years, you apply AI in healthcare is sharply increased, especially in the USA and China. And the second benefit is a constant sanitation in VR environment. So even even our speakers is in the USA, in Singapore, in China, so we can communicate long distance. Another type of thing is using treatment in a simulated setup. So final benefits is using AI in surgery. And also, for example, is use AI in medical training, but AI used in surgery is more and more. So actually, in the future, we have more and more advanced technology in nursing education. Just now, I only introduced some several examples. Actually, many technology companies introduce many products. How to apply this education methods in nursing? For us, is mainly I just introduced 2 examples to show how to apply methods in elderly care and intensive care. So in China, actually, metaverse is developed very quickly. I heard the news from Shanghai Regional Hospital have already developed the first metaverse hospital, but I didn't get any details. I only heard this news, and I also expect to see what's the to take a look at this hospital as well. So that's all my presentation.
Thank you. Thank you, Yingchun. Yeah, it's amazing, very informative presentation. So I will also have a very quick summary of your presentation. There are too much information there, so I hope that I'm able to summarize your presentation. So Yingchun's presentation actually focused on the application of immersive extended reality XR and metaverse in nursing research and education. So Yingchun actually provided a very detailed overview of XR technologies, which include AR, VR, and MR, mixed reality, and their application for cognitive assessment rehabilitation, particularly for patients with cancer and also the elderly with mild dementia. So in her presentation, Yingchun also highlighted the advantages of VR in delivering consistent and controlled stimuli in cognitive assessment, which actually can enhance diagnostic accuracy and treatment effectiveness. Dr. Yingchun also discussed on how the metaverse can be controlled to construct immersive education environments tailored for our nursing students. So that part is very, very interesting. So these environments actually can integrate virtual and real interactions, offering nursing students a very comprehensive understanding of medical procedures and patient care practice. That's amazing. So a very highly informative presentation. I believe we do need some time to absorb and digest the content that she shared with us. Okay, I'm sure that you also have some questions for Yingchun. So later, please, any questions you can actually put up in the chat, either in Chinese or English. I think are fine. So just raise your questions there. We will answer your question at the end of the session. Okay, now I would like to invite our third speaker, Dr. Jiang Ying, to share with us about her topic on crafting community well-being development of an AI-powered sing dance exer game for older adults in Singapore. Jiang Ying, please.
Okay, thank you, Prof. Wenru, for the kind introduction. Good morning, everyone. Good morning, colleagues, teachers, professors, and students. So thank you. I'm very grateful to have the opportunity to share one of my research projects. So we are using some of the exer game to try to promote health and then for older adults living in the community. So, Okay, so this project is actually funded by NUS Fund and is in collaboration with Lion Befrienders, Senior Activity Centers, and we work very closely with NUS and Lion Befriender, and I'm the PI of the project. And I also want to take the opportunity to thank all of the Lion Befrienders participants as well as their center staff in a way to help us to during the whole study projects and the active participation in this study. So for the presentation, I would like actually it's very simple. So we will just briefly touch about a little of backgrounds, why we are conducting these studies, a little bit on literature reviews to show some evidence. How do we conceptualize the intervention? How do we develop the intervention? And then we have conduct a pilot feasibility study. So I will also share a little bit of the study outcome, which is just completed. We just finished and complete the data analysis in March. So it's still very new. So Prof. Wenru have mentioned earlier on that because Singapore is undergoing some of the demographic shift. So our population is aging very fast. So there are definitely a lot of impacts because of the aging population. So the impact will definitely on like Prof. Wenru have already mentioned, chronic disease prevalence to the healthcare. So the one that pertinent to our research is more on the change in their functions. There are a change in sensory or motor system which may lead to diminished muscle strength and balance problem, which will cause gait disturbance and increase their fall risk. As well as change in cognitive function because of structural or functional alteration in the brain. So this is part of the change associated with when people get older. And we know that a person to enable to walk and steadily and is actually a continuous interaction, and not just a physical body, the lower limb strength, it's also a cognitive functioning. So the poor physical and cognitive performance actually is one of the risk factors for fall among the elder populations. And we know that accidental fall have a very significant negative consequences on our older adults. It's not just cause of physical impairments such as like fracture, exacerbate the functional decline, as well as subsequent disability. Also, it will have some consequences on the psychological and mental well-being. So some people, some elderlies, if they have a fall, they may have developed this so-called fear of falling, and which in a way that further limit their physical activity or the willingness to participate in activities. And further limit their mobility, which will subsequently lead to higher risk of fall. So it's like a vicious circle. So, and we also know that about 1/3 of community-disabled individuals who are aged 65 and above will experience at least one fall every year by research evidence. So sometimes when the patient or sometimes when elderly come to the clinic to see us because of fall, actually they may have suffered silent fall in the community. So they may have a 1 or 2 fall before they really surface in the hospital or clinic setting. So the whole idea is that effectively we want to make a bit of like do something upstream. So we want to center our efforts and in prevention or even health promotion in the community. So this is also in line with current change in the Singapore healthcare system, which we emphasize a lot of primary care and preventive care. And then we look at, so how do we do this? So we know that there is a lot of benefits of being physically active. So physical exercise and being physically active not just improve your muscles, your strength, mobility, balance, improve your quality of life. Also, there have benefits about your brain, your cognitive functioning, and as well as and your mood as well. So exercise make you feel good about yourself. So we all have this knowledge about it, and then Dr. Weichao also just now mentions, but we know that there is a benefits. We know this is activity group, but the problem is always about the behavior. So the problems is always about, but people are not doing enough for it, especially for the elderly, population. So it's not meeting the desired levels of physical activities. And then the question is that then we want to ask them why they don't even they know that there are so much benefits about being physically active, why they do not want to participate. So we look in the literature, we find what are the common barriers to traditional exercise, why people are not doing it. So this one should show you. So some of it is we also know, we have this knowledge about, sometimes because maybe it's due to the nature of the exercise, because it's a monotone and repetitive of the exercise. And then they do not see if it's very useful, because some benefits it's not so immediate, so it may take some time to show the effect. And sometimes it's just simply bad weather, transportation, or maybe older adult, if they want to go, they want to have someone to accompany them, and because of due to the psychological effect of fear of falling. And we also acknowledge that actually while there are a lot of like group exercise in the Singapore community, we have a lot of senior activity center, but not everyone like to be in a group exercise. So some people, they do not feel comfortable like exercise with others, and they may feel joining physical facility may be quite intimidating. So some older adults, they may already have existing chronic conditions, and they are realized that they are maybe in poor health, and they're self-conscious about declining body and ability. So going out exercise, sometimes when people look at them, then they may feel a bit uncomfortable, and sometimes they may feel embarrassing. And we also acknowledge that sometimes they may just attracted by other more fun activity like playing mahjong, which is very good for cognitive functioning. But so there are many reasons on that. Then we talk about, so can we make exercise more fun? How do we like overcome some of the barriers to exercise? So our thinking is very linear. So we have questions that we look at the literature, then we have some answer, then we think about the next, what we can do for the solutions. So like many other fields, because of the technology now is a big thing. So it evolved very fast. So we also want to think about, so how do we harness the power of technology to promote physical activity, or even for other health prevention or health promotion for older adult or many other or other population. So with the first things that come into mind maybe is exergame. So exergame is it's not something very new, but it's quite familiar for us as well. So there are a lot of commercial exergames out of the market there. So it's and then especially COVID period. So people because all the facilities are closed, and then so some people they do find that so playing some of the games they help them exercise at home. But the problem is it's really cater for a younger population, for the younger adult. They enjoy themselves by playing games, but this contents and the requirement is just not meet the older population's need and demand. So some older peoples they are in terms of their function, needs, preference, and processing speed are very different from younger population. So this something is good, but it's just not meet the needs of them and the demand of them. So we need to relook at it and how do we make it more suitable for the population of our interest. So we look at the literature again. So yeah, so it's a repeated process. So we look at literature again. So we see there are research on exergame and like in the lab settings, and they develop specific exergames for older adults. So some of the study often reported what they like. So they like something that is friendly. They like something that is related to their reality. So they may not, for their age, they like something that is really related to their past experience, the life they've gone through, the culture. So it's we need something that is culture sensitive, and they also want to increase it's a collaborative play instead of competing with each other. So they enjoy the like everyone's there and cheering for each other, the social presence of game. So these are the design, something they are really they prefer this kind of design instead of the other like more competitive game playing, and yeah. So they have different needs. So we can see they have different needs. Then we look at what the content. So we're thinking about what are the possible game content that fit their preference or fit their needs. So we look at dance. The dance is actually not a very like out of nowhere kind of thinking, because it has a good population foundation. In Singapore, actually, in our Active SG Sports Center, they organize a group dance exercise, a light dance exercise for older adult, for people. And especially these are before COVID. There are many good exercises ongoing in the communities. But because during the COVID time, these activities are all stopped. And suddenly people realize that the original way of organized activity cannot be like implemented as usual when there are a pandemic or when there are public health emergency. So at the time we are looking at others like available solutions, or then how we would continue our like these good habits in terms of if there is something like contingency planning for continuing our good practice in terms of like promote exercise and promote this community bonding of game activities. So dance is a very good activities that is not just improving the physical bodies in terms of like strengthen the lower limb muscle. It also have benefits in terms of improve the person's flexibilities, the overall coordination. So they had, in comparison to traditional aerobic or exercise, it have there is a component is like cognitive for cognitive functioning as well, because they need to coordinate. Also because of the music, they have some music, and then the music have an effect that may evoke better feelings emotionally. So they have additional benefit in terms of conditions and emotion benefits as compared to say just doing a running or jogging or traditional exercise. So then we want to take a look and see, so if we combine those two elements together, dance and exergame, whether one is the what is the effect, because there are research saying dance alone have effect, exergame alone and may also have effect, but then dance and exergame whether they have effect or not. And then importantly, whether older adult is more receptive, whether they are happy, whether they like this kind of combination. So we conducted 2 systematic reviews and has been published. So one is really look at the qualitative part, the experience part about experience. So this one published in International Journal of Nursing Study. Another one we want to look at the effect. So what are the good effects by using this combination of interventions? So the other one we published in the Journal of Gerontology. So from the review of the literature, so from the review, so we found that many so we find that the paper include the so-called dance exercise. Actually, many of them, they are done in lab-based, and then many of them, they use this kind of, they call it step manual. So they need to use a stepping mat. So this setup, so this stepping mat maybe it's quite familiar with some of the audience, maybe familiar with me, and when I was younger, so we play the dances that they require have a mat. So this is still quite older type of exercise. So it has been there for some time already. But technically, this is not the dance that we want. So this is more like stepping, more like tempo, more like matching the like step to the music. So it's not really the whole body exercise like a dance, not something that we wanted to do. So there is not many of the intervention available after we review the literature. So we think that because now the technology has changed, the old type of exercise, actually we can look at it and use a new method to make it better, or to curate the content better, to redevelop it to be more efficient or cost efficient. So we want to use a new way called this actually by machine learning. Yeah, this is by machine learning. So we want to use to check the key points assessment and supervised machine learning. Actually use decision tree to calculate the accuracy of the score based on dance movement. So in a way that, so therefore we can have something like this. So in a way that it can have a new way of like designing the game. And because we also keep in mind that the intervention is used in the community, will be used in the senior activity center. So many senior activity centers in Singapore, they are equipped with mid-range computer system. So they may have laptops, but it's not a very super computer. They are mid-range laptop. They may have a big screen, something set up like this. So we want to let our intervention is very easy for them to adapt. It needs to be very lightweight. It needs to be portable. And we also think about easy to install. So later on, it's easier to deploy and scale up. And the content can be adaptable and can be customized to different populations. So maybe this community center, maybe people are more frail and they are older adults, maybe different form of another community, maybe they are more active. So the content, if you want to change, is more easy to change to suit different needs of the community healthcare providers. So at the same time, we also hope that it can save some manpower, because if we have a record, then we may not need always engage a professional dance or teacher to teach the people to learn how to do the exercise. So, and in a way that is cost efficient. And we submitted, earlier on, we submitted a research letter to GEMDA to talk about our development. So it just have given acceptance, I think this month, so not long ago. So I think this one will go out. Yeah, the paper will go out soon. So this is our, so what are the intervention then? So this is actually the intervention. I just play the videos. So we engage a dance choreographer to ask him to choreograph and design some of the movements suitable for older adults with the emphasis of the lower limb strength. And then you can see this is the engineering, so to trying to train the machine learning model to able to pick up the key point and then scoring. So the one that you see is not the final version. So it's in fact it's a very beginning version. We are trying to still trying to adjust the calculation method. So this is. And then, so we use this one. So it's a very preliminary because of the it's a seed funding. So it's a very preliminary. So we bring it down to let the older adult try. So some of the, you can see this one. So this one is K-pop. So this one is how they do the exercise in the senior activity center. So actually, I don't know whether you can see the others when they are in the group, so they are sitting behind, so they are having good time observing their friends dancing, and they are having good time chit-chatting with each other. So it's in a way that it has like both play and the social time bonding. So this is this elderly is 80 plus years old, but he's very agile. So he has a very good baseline functioning. But we also see some elderly, they may have different medical condition. So sometimes not everyone is as good physical functioning. So sometimes not everyone will have the same levels of physical functioning. So some are good, better, some are maybe they will have to adapt, or they will have to improvise to dance with certain physical limitation. But they enjoy the process, they enjoy the music, so they enjoy let the body move along and then have a process of exercise and sweat a bit. So, and then this is another one. So we have tried, because we are not too sure what kind of song and what kind of physical or dance move they prefer. So you can see there are K-pop, there are English pop songs in the old days, and they also in Chinese songs. So some of the songs are, some of the dance actually is like quite fast paced, but the move is relatively simple. It's repetitive. It represents some of the like low or moderate levels of aerobic exercise. But the others really more resemble to ballroom dance. They have a little bit more turning and like change, require higher ability of balancing. So we want to try out. Then when we in the study we conducted, we also asked the opinion end of the study, which type of song they like, which type of move they like. Of course, like whether fast or slow and things like that. So we want to make it a trial first. So we conducted 2-arm pilot randomized control trial with repeated measures. So the aim of study, because it's just a pilot, so we want to assess first, importantly, is whether it's safe or whether it's feasible of the intervention. And we want to see whether there is any preliminary effective trend, whether it's a good trend in terms of outcome measurement. So the data is collected at baseline, immediate post-intervention, as well as 6 weeks, as well as 3 months from baseline. So these are some of the outcomes. And these are our, we recruited 60 participants. So this represents the social demographic of our participants. So you can see majority they are female and Chinese, and also quite represents to our the group of people they will go down to join the senior activity to join the activity at senior activity centers. So majority the female, so maybe Chinese, and because of them, we subsequently follow up to 3 months. So there are dropout. It's about 20% of dropout. So subsequently, we can see that, okay, because of the small sample size, majority of outcome is no significant difference. But we can see some of the good trend. For example, this functional risk test. So while at baseline, maybe the control performs slightly better than the intervention group. But we can see immediate after post-intervention group, the intervention group has more better than the control. However, at 3 months, the difference may be narrowed down. So, and the others are maybe intervention performed better, but it's not statistically significant. And also because here you can see, because the center chose certain participants for us to join this pilot study. So mainly those in the senior activity centers participants, they have quite good, I would say they have, most of them, they have quite good levels of functioning. Their baselines are very, very good. So in this one, the number of 4 actually at baseline, actually not many people have 4s. At 3 months later, both groups do not have anyone have 4. So there are some ceiling effect. Very hard to see any significant difference between the 2 groups. So this one is a symptom for depression. While there is an effect, but I would say this is by chance because baseline there are some significant difference among the 2 groups already. So the subsequently effects may not be due to the intervention. So actually, also because there is no significant difference between the 2 groups. And this one is similarly for the activity of daily living. So and then when we also look at the attendance, motivations and adverse effects. So we found the attendance is about 80%, which is not bad, because we need the participant to do 3 times, come to the center to play this game 3 times a week for 6 weeks. So for full attendance will be 18 sessions over 6 weeks. And we see the participants to rate their motivation levels and their enjoyment levels. They are also quite satisfactory. It's about 4.57 and 4.6 over 5. So we think there is no major adverse effect happen, no falls happen during the intervention. So while there is maybe a few of participants feel slightly stumbling during turns, but actually overall, I would say it's still quite safe. Yeah, they are able to regain their balance or with some little assistance by the research assistant. So we think that dance is a very feasible intervention and is safe, and there is we can observe, we can see there is a lot of enjoyment when we do the intervention among the participants who join the activities. So, and then despite the effectiveness not able to establish in the pilot study, but we plan to implement a full-scale RCT with better curated content and with better choice of more sensitive instruments. So the pilot study serves us as a testing platform of this approach, and then definitely we have learned a lot and gained insight for this in the pilot studies. And we are also happy that even after the pilot study, there are centers that reach out to us for installation of our application. So some of the centers actually is not the site that we do our study. I think they heard about other centers. They have this study ongoing, so they also want to try to let their senior to play this game in their centers. So we want to develop a better curated content, a dance content for our participants. So the next we are working on Dancing Dance 2.0. So we are also working on some of students from lesser colleges of art and with colleagues, daughters from Performing Art Lessons Singapore. So in a way that they are experts in dance as well as they have expertise in medicine. So we think that it will be a better one to curate the dance movement, because that will be the critical intervention element to let the intervention to have effect. So this is just some of the new dance moves. So the student will do will become a dance choreographer to perform the movement, and then you can see some of the movement. Now we have made some modification to really emphasize of a lower limb strength, a little bit of like shifting the waist, balancing, and a little bit of like stretching exercise, stretch the body. Yeah, so to make the body more less tense and more relaxed. Okay. Okay, so with that, I think I end my presentation for my project. So this is my contact. So if anyone you have interest for research collaboration, or you are interested in the Sing Dance project, welcome you to we can contact me, and then we can discuss further. Thank you very much for your attention. So I shall end my slideshows now. I'm happy to take some questions.
Okay. Thank you, Jiang Ying. Thanks for your presentation. So yeah, I would also have a very quick summary of Jiang Ying's presentation. So we know fall prevention, physical exercise are very essential, very crucial to promote healthy aging. So Jiang Ying and also her team designed this very interesting, sing dance program. It's actually a dance-based exercise game for older adults to enhance their physical function, psychological well-being, and reduce falls. So we can see the result from her pilot study actually suggests sing dance is both feasible and safe for older adults. Yeah, the team is currently planning the upgrade version of the exercise game. They also plan to do a full-scale randomized control trial study to prove the effectiveness of the game sing dance program. So we hope to see the result from the full-scale trial very soon. Jiang Ying, excellent work. Okay, so I think we are overrunning the program, but I will still leave some time for Q&A. So yeah, maybe we look at the chat first, and we have some questions from the audience. I think the first question is for Weichao. So Weichao, this audience asks, about your chat. So your bot is on chat. So the audience asks, is it built of a commercially available base large language model, or did you build it from scratch? I think this audience refers to your Coco large language model.
Thank you. That's a great question. By virtue of being a large language model, there are more what we call general AI, AGI, so artificial general intelligence. So they're not tailored to specific applications. It's more of a general use. So to tailor any large language model for specific health delivery, we would need to tailor it. And for us, because of considerations of privacy issues, confidentiality of our patients, we aren't using those commercially available ones. So we're actually using some of the open source ones, like Meta has the Llama, and then there's another one, Mistress, I think, something around that our team is trying out different. So open source ones that we can run in our own environment, secured and confidential. So but we do run them on the virtual machines, like on a cloud. And then I think there is another question, the second one around how to use Chat GPT in mainland China. I know there are some different kind of access issues. I do think there are some Chinese large language models that are, I think there's the Huawei has Pangu, and then I think Baidu has Wenxing Yiyan. Those are language models that are developed in China, and I think they're based on transformer. So a lot of the large language models are based on the previous generation of generative AI on transformers, which is Google's open source ones. So and then each company would take it. So for you all, if you're interested in kind of delving into this research, you can use some of the open source ones and then fine tune or use other methods to kind of tailor it to your use. Thank you.
Thank you, Weichao. Yeah, I think maybe I also threw up a question for Yingchun. So Yingchun, you have done a lot of studies on using XR technologies. So how do XR technologies specifically improve the learning outcomes for nursing students when compared with the traditional learning method?
Oh, thanks, Professor Wang's great questions. Yeah, actually, when we apply the XR technology in nursing education, the first benefits will be enhance the engagement and the retention, because XR technology creates immersive and interactive experience, capture the attention of learners more effectively than traditional methods. The secondly benefit is more safe and controlled simulation environment, because XR provides a safe platform for nursing students to learn practical skills and the procedures without the risk of harm actual patient. And the second benefit is the instant feedback and the adaptation, because exercise environment, just like shown in the videos, can offer immediate feedback to students, which is crucial for learning and improvement. This feedback can be tailored to specific action of students within the simulation, so can allow the nursing student to learn and correct their techniques in real time. Also, finally, so this kind of exercise technology can offer standardization of training, because when we teaching different teacher teaching a different way, but we use the exercise technology, ensure all students receive the same quality of training, which is consistent scenarios and the standardized assessment. So that's all the benefits when we apply this kind of technology compared with those traditional methods.
Thank you, Yingchun. Yeah, I think we have been using technology in our patient care and also nursing education. I believe, Weichao, maybe from your school, and also I know many schools in China, nursing schools in China, they have already adopted very advanced technology in their teaching. So I think we do, probably we can find another time to do another webinar just specifically for technology in nursing education. That would be very interesting. Maybe my last question goes to Jiang Ying. So Jiang Ying, we know a lot of the time, the female elderly, they like dance, If you go China, a lot of what we call 广场舞, square dance, you see a lot of female elderly, they actually like to dance. But for male, they may not really dance. So, how about those older male adults? Do they also like to dance, or whether they like your extra game? Yeah.
Yeah, thank you for the question. Yeah, it's a very important question. We also observe during our intervention. So majority of the participants, they're very enthusiastic to come in to do the study intervention are the female, and they like to chit chat with each other. Yeah, we are aware of that. So we are thinking use this model first. Probably the male, we have to decide another type of exercise for them. Some male maybe, I don't know, maybe they like to dance, but in the private settings may not be in a good dance, or maybe they like to perform other form of like boxing or martial art exercise instead of really a very familiar female dance kind of dancing, or maybe they like different type of dance. I don't know whether cha-cha or so. We are still trying out, and then we can get some feedback. So we actually also interview, we have actually also get some qualitative feedback and do a qualitative process evaluation from the participant. Probably we can learn and then from some insight to how to make our intervention more cater to their needs. Yeah.
Thank you, Jiang. Yeah, we are also looking forward to your upgrade version of Exit Game. Okay, so I think very interesting session today. I hope the audience have learned something from our three speakers, very informative presentations. I also learned a lot. So I think with the rapid advancement of the technology, we cannot run away with the technology. So that's the future trend. So not only in patient care, but also in our nursing education. But I want to emphasize, no matter how AI played a role in this healthcare system, I think human being, our healthcare professionals, still play the key role in patient care. So I always said, we need to have this concept called human AI symbiosis. So whenever you think about your intervention, you develop any program, you want to integrate your AI in your interventional program. So always, I think about how healthcare professionals play a role in that intervention. Okay. So I still see some questions coming. sorry, we don't really have so many time. We don't have much time to answer your questions. So if you are interested in this project, you can actually easily find the contact information for Weichao Yingchun and Jiang Ying. So feel free to reach out to them. If you cannot find their contact information, you can easily find my contact information through our website. So you can actually contact me, and if you are interested in any research collaboration, you are most welcome. Okay, thank you very much. With this, I will just end the webinar. Thank you all.
Thanks, Professor Wang. Thanks,
Thank
Weichao,
you.
Jiang Ying.
Thank you.
Thank you. Yeah, thank you all. Bye bye.
Weichao, take care.
Take care.